Good evening. We've learned there's been a huge uptake in a new program that gives prescription powers to pharmacists across Ontario. Hundreds of thousands of people have been treated for minor illnesses, easing the burden on doctors' offices, hospitals, and walk-in clinics.
When we started, we knew it was going to be busy. I think we're surprised by the demand.
The pharmacy at an East End Shoppers Drug Mart is packed with patients, many of them not here to fill prescriptions, but to get them.
You could actually get access to some primary care, get seen by a pharmacist, treated for a minor ailment, and many times getting a prescription all within 10, 15 minutes.
So much faster.
So much faster. And you can see the pharmacy today is very busy. And many of these patients here, they're accessing that type of care.
The Ford government gave new powers to pharmacists in January to write prescriptions for minor illnesses. And the first 6 months of the program is being called a huge success.
Tremendously successful. And it's really demonstrating how it's helping to fill some of the gaps and create capacity in the healthcare system, because we know that over 2 million Ontarians don't have a family doctor.
And it is because of that shortage of family doctors and long wait times at hospitals and walk-in clinics that demand is skyrocketing. The Ontario Pharmacists Association tells us pharmacists prescribed treatments for almost 250,000 people in the first 6 months of the program. More than 80% of pharmacies in Ontario are participating.
So that's an incredible number. And it's actually much higher than we thought it was going to be. Some of these low acuity patients were going into walk-in clinics. They were going into trying to get physician appointments, and some even go to emerge.
Of the 13 ailments pharmacists can prescribe treatment for, the most common 3 are cold sores, conjunctivitis, and UTIs. While 6 more ailments will be added to the list in the fall, the OPA says Ontario is behind other provinces that have upwards of 30 conditions included in their programs. They're also urging the government to add oral contraceptives to the list.
This is a big miss in Ontario. Women's health and access to these types of services is critical. It's a cautious approach in Ontario when you compare it to the other jurisdictions.
And there is still room for improvement.
It's really exciting as a profession, as a pharmacist, it's really exciting. But on our level, we haven't seen too much uptake.
Some participating community and compounding pharmacies tell us the public may just not know they offer the service too.
But I think that more people, as they become more aware of it and they understand it a little bit more, because it's kind of confusing, minor ailments prescribing, it's a mouthful, will probably be able to adopt it a little bit more regularly.
And on a different note, the number of pharmacy robberies is up once again. Toronto police tell us there have been 135 so far this year. That's a 30% increase from last year. It's now mandatory for all pharmacies in Ontario to have time delay safes, but we're told because of a supply shortage, some pharmacies are still waiting.